Hi everyone, welcome back. Anna here with the Coding Guild. Today we are going to examine another evaluation and management modifier, one that doesn't really get much attention even though it should because it's very important. Of course, I'm talking about modifier 27. What is it? What does it do? And why do you need it in your life? Let's see. First of all, we have to clarify that this modifier is used for outpatient facility coding only. If you are a profi coder, this modifier is not for you. Hospitals will submit modifier 27 on the UB04 hospital claim form for repeat facility EM services provided to the same patient on the same date of service. Remember that facility evaluation and management coding follows very different rules from profi EM, and it also has its own limitations. Without going into too much detail on that, it is important to remember that a facility's service to the patient is its infrastructure. When a facility charges an EM code, what they want reimbursement for is the building, where the evaluation and management service took place, money for the staff working there, for the supplies consumed during the EM visit, for any equipment necessary during the visit, for the sterilization of the examination room before and after the patient's paper gown, etc. What is unique about these material services that the facility provides is that most of them perish during their use. Of course, the building remains, but the nurse already used up their 15 minutes on the patient. They will never get this back, and it will have to be reflected in their wages what the facility will provide. Some supplies are just gone during the exam, for example, spatulas. Some equipment might need to be restocked or re-sterilized. Same goes for the examination room. And the patient's paper gown or bed sheet also need changing. As you can see, the facility will incur costs the moment the patient passes through the examination room door. If the patient comes back for a second evaluation and management service, these costs will be incurred more or less to the same extent. Returning patients are usually not a problem for physician coding because if the patient presents with the same issue, the provider will just take the two notes from the two visits and level them together to bill one unified EM level for both of the exams. This is possible because during the second visit, the provider already builds on information they obtained during the first visit. They don't have to restart from the beginning. But the facility can't really do this because once the patient leaves after their first visit, the facility's resources are gone for good. When the patient returns with the same problem on the same date of service, the facility is none the wiser. It cannot build on previous visits because it cannot give the patient back the used room, the used bedsheet, the used gown, the used everything. And here is where modifier 27 comes in. In order to get the facility paid for all its material services, modifier 27 will need to be appended to the second and subsequent EM codes submitted by the facility. The official descriptor also emphasizes that this modifier exists in order to get the facility paid for the repeat utilization of hospital resources related to separate and distinct EM encounters. You can also notice that the descriptor specifies that this modifier should be used for EM services at different outpatient departments. And while this might have been the original idea behind this modifier, this is not entirely true for real-life coding. According to the definition, modifier 27 would be used when the patient is seen at different departments of the same facility, such as a clinic visit in the morning, emergency department visit in the afternoon, and critical care at night. In real life, though, we can use this modifier on evaluation and management codes as needed, regardless where they occur. If, for example, the patient has 3 emergency department visits on the same day, then the facility will charge 3 ED-EM codes, the second 2 with modifier 27. An important remark: there are specified code ranges this modifier can be used with. Examples can be seen here. But in general, any CPT or HCPCS code with status indicator V will work for modifier 27. An exception to that is critical care, listed here. This one is status indicator S. If you are not sure how to check status indicators and what they are for in the first place, have a look at my videos on those topics separately. They are linked up in the corner and in the description below. And with that, we have reached the end of this topic for now. Thank you for being here with me today. I will see you soon in our next video.